I want to go over this video from the University in Sweden here, and these two gentlemen recorded this several years ago, but it's a very, very helpful thing just to learn something about the temporomandibular joint. And you can watch the video yourself, but I want to go over it with just some instructions of my own to you. This is just a picture of the joint itself. Now this part here is the condyle, and this is the disc, and the disc is connected here by an upper and lower, the upper joint space and the lower joint space right in here. Now I'm going to go ahead and advance this a little. And these are the two gentlemen that did this cut down in the films on this. Alright, now this is a joint that is good. This is a normal joint here, and I'm going to kind of click this over as I can stop this or start it. And this is the double concave disc in here. This portion of the disc takes a lot of pressure. Like if you bite your front teeth together out here, you move your jaw forward and bite your front teeth together, then there's nothing between your posterior teeth, and all the weight is right here on this joint. So this has to take a tremendous amount of pressure. The muscles are closer to this joint than they are to your front teeth. So if you bite with 10 pounds out here in the front, it may be 20 pounds of pressure on the joints. They may be shared. Now this is your retrodiscal tissue in here, and this will get squeezed up in this space, and that's where your synovial fluid is formed. And this fluid feeds this joint. There's no blood vessels and no nerve endings in this portion of the disc right here. And so the synovial fluid is in the upper joint space and the lower joint space, and it's kind of squeezed out of the tissue, of the retrodiscal tissue that's highly vascular right in here. Now this lubricates the joints, and it lubricates and also feeds the material here that the disc is made out of, this dense connective tissue. And this tissue is fed by the synovial fluid, and then it is after its waste products are carried off by the synovial fluid. It's a tremendously complicated joint. So let's go ahead and look at some more of this. This goes slow, and watch it come down. And now it'll go, your mouth is open now of this person, and the condyle, which is right here, will come up on the slightly the front part of the eminence. Now this, if you look at a skull, you'll see this eminence right here. Now once in a while people will get this thing messed up and get the condyle out in front, and it'll slide up here, and it's really painful. You have to know how to push the molar teeth down and slide this back in a case like that. Now let's go, and now that's about as far forward as it goes, and now this is going to go back, and you can see it crowd this portion of the disc up into this point here, and this is your retrodiscal tissue. And if your condyle goes too far back, it irritates this, and that's where your synovial fluids kind of manufactured, and the blood vessels and nerves are quite prevalent in this area right here. Now let's move it on a little further, and you can see it stop there. Now that's where it goes in, and it pushes that portion of the disc up in there. Now we'll come on out here, and it'll go, and right there is the forward portion of where the condyle now is out in the front of this portion there. Now this disc gets pulled off the head of the condyle, which is where it goes mostly when you get a blow or something that pushes the condyle back real hard. It'll shove the disc out in front of it, and then it has to pop back up on it. That's where you get this click. I'll try to show that. And now let me see, that's about as far as that moves in a forward direction. I'll go back out there again. There it is. Whoop. I didn't shut it off quick enough. Now this is another deal where another person. Now you realize that these are live people that have passed away, and they get to them very quick, and maybe they've taken a history on them if they knew them before they passed away. And the ones that had problems, maybe they knew something about it. Now they have shaved off this portion of the human and cut through the condyle and also the eminence up here, and cut part of the tissue off of this, so the movement of this disc won't be exactly like you see it here, but they try to get it as close as possible and took pictures of it. And this helped me greatly over the years. I've watched this video many times and used it in lectures, and I hope some of you have already seen it, but you can show this video, and it is excellent for helping people understand the joint itself. Now I'm going to keep down here again and turn this thing on, and this one has a kind of a joint is worn out to some extent. It has a spot of the disc that is worn through. Now this disc may wear through from various things. If we used to, if you did a surgery of the joint and they wired the head, the joint portion back up together and kept it mashed together for several weeks or maybe a month or so, and the disc that is so tough and hard and takes all this punishment for years. Now I'm be 92 here this month, and my disc is still good. I had one damage, but you can put your fingers right in front of your ears and you can feel this condyle just right in front of the ear portion, and just press lightly on it and open and close your mouth, and you'll feel the disc under your finger, and you can kind of roll your finger around like that, and that will kind of tell you where the disc is and where the condyle is. Now if you open, then this condyle moves down and forward like that, so you can kind of check your own TMJ problem yourself. Now, when this one over here that I've got covered up with a speaker, it gives me trouble sometimes. I got it damaged in skiing over in Europe one time, and it gives me a little trouble from time to time. Now, you put your finger on that and kind of roll it around, and when you open and close, you can feel a lot of the head of the condyle. Now, if this is highly sensitive, if it gets swollen up or damaged or anything, it'll get swollen, and you can take medicine to maybe do away with the inflation of the inflamed area, and that will help it. But normally you've got to get at the cause of the pain, and so I'm going to kind of skip out. Let's go back to the disc. I want to show this disc a little further along here. Now it squeezes. Now the jaw is going forward in this one, and the ones we saw before was going back the other way. It may get you confused. Now it goes on out. This is the eminence now right up here, and it's going to go out past the point of the eminence, and now it's going back up again. Now, in this case, this disc has been damaged. It may have been a blow or something of that nature, or the person may have used it wrong and worn a hole in the disc, and so there's just bone on bone contacting right in there. Now they're going to drop this down, and you can see the hole in the disc. Now this disc is cut in two. Now here's another method here. Now this disc pops off and on, and the disc loses that biconcave shape. It is just straight up and down right there. Now here the condyle closes into the space. Now this jaw is open in a forward direction over here, and sometimes that gets a little confusion here. Now the disc, as the condyle goes back and you put pressure on it, the disc pops out in front. Now as we move the condyle forward, and the disc itself has lost most of that biconcave shape. It's kind of straight in a line, and it's not completely straight. And sometimes if you catch one of these when they first got damaged and it's popped off and it pops on real quick, you can build a splint that holds the jaw and doesn't let it pop off, and the shape of the disc will again form this biconcave deal that you see on a healthy one, and that itself helps keep it on. So sometimes you can get rid of the click in treatment, but if it's late in the opening of the mouth before it clicks, like if your mouth opens way down here and then you get a click and you go back and you'll feel it pop back off again, and it's just a kind of a dull noise. You won't hear much popping off, but as you go forward and it pops on. Now let's turn this on and watch it go forward and pop on. Now you'll see it come now. It'll be just real quick, and it popped back on again. So that's where you hear the click. Now it's slipping off there, and you don't get much of a noise from that, but the click is right in there. Now the biconcave shape is by far most of it's gone, Now if you can put a splint on this person and stop them just before it goes off right there, and let them go for several weeks or a month, couple of months or something wearing this splint, the disc itself will thicken back up on the outside, and also the inside hasn't gone off yet. See, so it stays pretty good there, but the back of it is what has the big ridge. Now this is your synovial fluid, and the synovial liquid kind of seeps out of this tissue into this, and it gets in the upper joint space and the lower joint space. So let's move on now, and you see this close, it pops off, and pop it off and on like that. The disc loses most of this biconcave shape. Now this one right here, let me stop, and you can see this anterior displacement of the disc. Okay, we'll start it. Now this one is worn bad too. Now it seems like all of these people, they wear down, but now I've been using this disc, the disc that I have for 92 years, and it's still smooth as can be. You open and you don't hear anything, and my jaw stays steady. Now if the disc pops off on one side and not on the other, your jaw will kind of go to that side to a little bit, and then it'll fall and you'll come back straight again and open up, and you get back here, it'll go back again. So you can see somebody opening and closing their jaw and just know what's happening up there. And so you try to stop it and adjust it and help bring it up with a splint and keep it there a while. Then you take it off, and a lot of them will go back again. Excuse me. All right. This one is, maybe that's the same one we had. All right, here. Now the disc here is squeezed up here. This muscle is the tissue, the ligament holding that in, is quite thin, and we'll watch it go out here and pop back up. And you see it moved easily, and then it'll move back out to the outside. And you see it will pop out to the outside right now. There it comes. Okay, that is a mesial movement. Now in life, this guy had tissue all over this part of that, and it may not have eased off in there so much because there would be tissue on this side that's cut away. But this is a mesial displacement of the disc, and you can kind of feel it's coming back on there. Now this is another disc. Then you see it kind of stretch this out, and there's now the jaw's opening back to the right at this time. You see this slide back on. The disc slips off here, and then they open very much, and it slips back on like that. Now that's why it's complicated. The head of the condyle is curved. If you look at it flat in just 2 dimensions, you don't get the full meaning of it. But you see in the 3 dimensions, this is going in and over to the side right there. And you can get used to these and just feel them up here, and you know what to do. So you've got to get that thing corrected, and where it's pressing on that retrodiscal tissue, you got to bring it forward and to where it doesn't press on it, and then it'll be easy for them. All right, here's the thing sliding off. Well, that's not sliding very far there. Now this going forward out here, it stretches this ligament in here, and that's where it puts pressure on it, and it pops back up on, and you hear the noise right there. Probably in life this guy's disc was not off. All right, here's another video that the disc just is worn out completely, and this ligament here is gone, or part of the disc is gone away, and it's bone on bone, and you leave this thing going like this long enough, and this it wears the bone down, and the eminence is flat. So I'm gonna back up just a little bit and talk about that just a minute. I had a patient once that I told them what was wrong, and they needed a splint to hold the jaw out to a certain position and not let it go all the way up. And it was, in other words, keep the condyle on the disc. Well, they never did anything about it. And about 15 or 20 years later, saw this lady, and she said, well, I didn't do what you told me to do, but the pain went away. And so she could open her mouth and close it, and it didn't cause any pain. And this type of thing doesn't cause pain, but you'll hear kind of a scraping noise. It's two things rubbing together like that. And this forms a kind of a beak rather than the round surface of the condyle and the eminence that has a surface for it. This will just beak out after this disc is gone, pretty much gone, and just rubbing bone on bone. You'll x-ray one and you see it looks like a flat level condyle in there, but it doesn't seem to hurt people. So this is, I think, one of the most helpful things to help you learn how the jaw works. And I would advise you to get this video and listen to it or watch it, and let it kind of teach you what to do in there. So I'm going to go ahead and we'll close out, and I want to thank the university there in Sweden for what they've done, and it's helped me tremendously. And this video was made several years ago. So I'm going to say goodbye and close this off, and thank you for watching.